Hi everybody, welcome to Healthline. I am Gregory Zarian. Thank you so much for joining us. So we are already heading into March. Okay, the New Year's is come and gone. Have you kept your New Year's intentions? Are you still working out? Are you still getting rid of the vices that you had last year that you didn't really want to bring into this year? Here's the great news. If you kind of slip a little bit, here at Healthline we always like to talk about baby steps. So to get back on that wagon or on that bike, just take baby steps to get your health back on. Because our mission here at Healthline is to have you be the healthiest you can be. Now our topic today is colorectal health, and March is Colorectal Awareness Month. And we are here today to talk about all we need to know about our gastrointestinal health. Joining us is one of my all-time favorite doctors ever. I'll say it again, favorite doctors ever, Dr. Sam Carvajal, general surgery from Glendale Adventist Medical Center. One of my favorite doctors ever. And you know how much I love you, so saying you warms my heart. How are you, Dr. Sam?
I'm doing just fine, and I'm so happy to see you here.
I miss you.
Well, I miss you too, man.
So, first of all, give us a little history as to your medical history, what you've done, where you went to school.
Well, I lived here locally for 18 years and went off to Loma University where I did my undergrad. And after that, I went to medical school at the University of California in San Francisco. And they were nice enough to keep me there after my 4 years of medical school, and I did an additional 7 years of training and research thereafter. And after having completed that research, I came back home to Glendale Adventist Medical Center.
I know that you say back home because our parents know each other, which is really great. So for me, this is family. Sam, gastrointestinal health, before we even dive into our first break, what does that mean?
Well, our gastrointestinal tract is something that's all very important to us. It's something that can cause great joy when we eat and are with friends and enjoy the food that we're eating, but it also gives us the strength and energy that we need to do our daily activities. But it also can cause a lot of problems, and there are things that people can do to try to minimize the risk of those problems.
And also stomach health. Stomach health is super important. Okay, so I'm going to leave you with a little trivial question. Where does your gastrointestinal tract start and where does it end? Because I have an expert that will give us the answer. Don't go away, more when we come back. Welcome back to Healthline. I am Gregory Zarian. Did you know that Glendale Adventist Medical Center is ranked 4 out of 5 stars by the Centers of Medicare and Medical Services for its star ratings? That's the top 20% right here in California. Joining us is one of my favorite doctors, my all-time favorite doctor, Dr. Sam Carvajal. But I left you with a Trivial Pursuit question. Today it's all about your colon health and the gastrointestinal tract in our bodies. Where does it start and where does it end? Do you know the answer? Okay, Dr. Sam, where does it start and where does it end?
Well, it literally starts right at your lips, because the part of when we're eating is we start out by chewing food and we get taste and flavor from that. And then from there, it goes down into the pharynx, the hypopharynx, which is that part in the back of the mouth, which transfers to the esophagus. And from the esophagus goes into the stomach. At the end of the stomach goes into the small bowel. And a small portion of that small bowel we call the duodenum. So a lot of people have issues with their duodenum. Then the small bowel completes after about 20 plus feet and then ends into the colon. The colon goes around and ends into the rectum and the anus. And that's the entire tract. But there are many organs other than just those hollow organs. There's things like the liver and the pancreas, which are very, very important.
And it's all interconnected, isn't it? Interwoven.
We need all of these organs in order to do the job of digestion.
And I want to address digestion, and I also want to go back to the duodenum. I said general surgery. Tell me a little bit more in detail as to what you do.
Well, I do general and vascular surgery, but in terms of the things that we specialize most in is in advanced cancer work and advanced minimally invasive work. So we do all of the big cancer operations on the pancreas and on the liver and the stomach and the colon. And we quite often will do these through telescopes and the most minimally invasive techniques in the world.
Which is what we've talked about many times, the SILS procedure, single incision laparoscopic surgery.
Right, that's exactly. It's a technique that I helped develop in this country, and the one that we have at Glendale Adventist Medical Center, literally the largest experience in the world. We've done nearly 4,000 operations exactly like this, and we can operate on all forms of the GI tract that way.
And it's pretty exciting because you and I were talking before we started that it was 8 years ago that it was introduced to Glendale Adventist Medical Center.
That's correct.
And if you want to become a superstar with the SILS procedure, all you got to do is reach out to my pal, Dr. Sam. What is the digestive system, Sam?
Well, the purpose of the digestive system is to gain energy from the foods that we eat. So it has to get those foods, break it down into initial manageable sizes. We do that with our teeth, and then our stomach grinds that food and empties out that food, and then we have to break it down into its basic elements to be able to absorb the sugars and the proteins that are there, and that's why we have pancreases and livers and so forth to help us do that. And then we have to be able to detoxify some of those things because we're putting all kinds of things into our GI tract. And so our liver has to help us do that detoxification so that we don't get sick from it.
Can people chew too fast?
The answer is you can.
Well, the people do chew too fast. Is it unhealthy for you?
Oh, absolutely. It's unhealthy to eat too quickly and not to chew your food. We recommend very strongly that one chew their food. We use the word mastication to do that. So you might hear somebody say that, to chew the food into small little bites. And we recommend at least 10 to 15 of moving your jaw up and down to get that to happen per bite.
Now, there's special people in my life, and I say that you eat too fast. If you could masticate a little bit slower, that would be better for you because it's healthier for you, isn't it?
Absolutely.
What happens to when you eat too fast? Is it just kind of like a shock to your body? Like, boom, all this food is going into my system quick, and there's like a manic panic in the system?
Well, I don't know that it's a panic because our GI tract is so good, even when we don't eat, and we take advantage of that so that we can remove things like an esophagus or remove things like a stomach and still have people be whole and be able to eat normally and be able to get nutrition normally. So our body's really capable of going the extra mile to be able to bypass these parts of our GI tract.
But doesn't it create a lot of acid reflux and a lot of
Well, so that's exactly what I was about to say,
that
that when you eat too quickly, a lot of things start to happen. First of all, you tend not to get the signal from your stomach when it's full.
Okay.
So one tends to overeat and therefore gain weight. Eating more slowly, chewing your food very well will help and give your stomach that time to give that signal so that your body knows when it's full and when it shouldn't be eating any longer. But also it makes it easier for the stomach to be able to develop that food and be able to not have to work as hard before it excretes it out into the duodenum.
and I said, what is the duodenum, Sam?
Well, the duodenum's that very first part of the small intestine after the stomach. It's where the pancreas and the liver output, the bile and the pancreatic juices exit out into the duodenum, and where the pancreas starts to do its job in breaking up those now small pieces of food into their elements so it can be absorbed.
I just love the fact that you said to eat slower. More with Dr. Sam Carvajal, and we're going to talk all about colorectal health when we come back. Don't go away. Welcome back to Healthline. I am Gregory Zarian. Did you know that March is Colorectal Awareness Month, and that is the entire topic of our episode today? But before we dive into that, did you know that Glendale Adventist Medical Center is ranked the 24th best hospital in California? out of 347 and is 13th best hospital in the greatest Los Angeles area. And that is noted by U.S. News and the World Report 2016-2017. Joining us is Dr. Sam Carvajal. Sam, before we dive into colorectal awareness and what we need to know and some staggering statistics that we talked about, if you eat too fast and you have some acid reflux and stuff, that can also attribute to other maladies such as esophageal cancer, which is personal to me, GERD, Barrett's esophagus, acid reflux. Talk to us about that.
Well, there's no question that reflux is a big problem. It's a big problem in this country. A high percentage of the U.S. population has a moderate reflux, and a smaller population have severe reflux. And when one has reflux, one can develop strictures, bleeding, ulcers, and most importantly, one can develop cancers, which are real big problems.
Why is it so prevalent, and what is it? I know it's the esophagus and the lack of it opening and closing in your GI tract.
Well, there is a muscle at the bottom of the esophagus. That muscle is responsible for going ahead and preventing acid from going up, and that can break down due to hernias. We call them hiatal hernias, and it can be due to having the stomach being too full, going to bed too quickly after eating. So you're laying down, food can go up, and
so you recommend time in between eating and sleep and going to bed?
Absolutely.
How much time do you recommend?
3 hours.
Okay, so give yourself 3 hours. Love that. Okay, great. And that also, though, if you also don't put on as much weight.
Absolutely.
Isn't it true? Because if you eat and go to sleep, that's where the weight, your body doesn't have as much time to burn itself with the food it's eaten.
That certainly used to be what we used to believe quite a bit. There are some recent studies which kind of have debunked that a little bit, but still we think it's far better to eat and digest that food before going to bed.
What about are all of these that we talked about, the GERDs, the Barrett's, the gastritis, are they hereditary? Is it from lack of exercise? Is it diet? Where does all that come from?
Well, a lot of people have thought that obesity is the thing that contributes mostly to that problem, but in fact it doesn't appear to be. That it really may be more genetic factors, okay, and just whether one has a hernia or does not have a hernia, whether that muscle is working well or not. And so they're just a whole contributing cause of it. But a thin person can have as much reflux as a heavy person.
What are signs and symptoms of a lot of acid reflux?
Would be heartburn, chest pain, would be difficulty swallowing sometimes, taste changes, acid in your pillow when you wake up in the middle of the night, coughing at nighttime because you aspirate some of that acid into your lungs.
But it's also chronic clearing of the throat and all of that.
That can be that, yeah.
And if somebody is feeling that, they need to make an appointment with you or a gastro doctor.
Absolutely. We recommend an appointment with a gastroenterologist. Talk to your primary, very important.
Going down to then the colon. Before we came back, some of the statistics: colon cancer is the third most commonly diagnosed cancer and the second leading cause of cancer in men and women combined in the United States. The American Cancer Society estimates that this year over 137,000 people will be diagnosed and over 50,000 will die from this disease. Why so much?
Well, it's a problem that, first of all, many of us don't get our colonoscopies like we should be, okay? We used to think that there were all kinds of different causes, like eating foods that have high nitrates or having highly cooked meats, for example, that would cause it, not having or eating enough fiber. And we think that these things are all important, but we're increasingly really starting to understand the genetic causes and the mutations that lead to colon cancer. And clearly it's not just one thing that one does to help prevent this. It's really just globally eating high fiber diets, eating good quality foods, not overeating, trying to make certain that your elimination's as regular as possible. And many people in this country have a lot of problems with elimination. And constipation can be treated. A lot of people do not seek that help from their doctors to help them eliminate on a more regular basis. And we think a lot of that has to do why people develop polyps or why people end up developing cancers.
In how many times a day should somebody in a healthy measure eliminate a day?
Normal elimination is 2 times a day to as much as once every 3 days. Now, I think that is the absolute longest, what we would consider normal. And
Once every 3 days is awful.
I would think, again, that's what we list as being occasionally as normal.
So
I will accept more likely somebody who eliminates every other day, as long as they're doing it every other day on a consistent basis and their bowel movements are not too hard. I will be okay with that. If not, then we start to do regimens to help them with that.
Now, when you say bowel movements far too hard, what is that?
Well, the colon, one of its things that it does is try to absorb water out of our bowel movements in order to help us make sure that we have enough water in our system. And so when we're dehydrated, we tend to absorb more water out of the colon, which then makes the bowel movements much harder. And we use the word constipation to refer to that process of passing a very hard bowel movement.
Bottom line is drink more water, if anything.
It's the very number one recommendation in constipations, drink more water.
8 to 10 glasses a day minimum.
Absolutely.
Okay, well, if you get anything from this episode, drink water. More with Dr. Sam and signs and symptoms of colorectal cancer when we come back. Don't go away. Welcome back to Healthline. I'm Gregory Zarin. I surely hope you went to have a glass of water after our last break. 8 to 10 glasses minimum every day. And if you're constipated, 9 times out of 10 it's probably because you are dehydrated. Glendale Adventist, it's the 4th consecutive A hospital safety score from patient safety organization, the Leapfrog Group. So that is why our mission here is to give you the best of the best in regards to doctors, health, and awareness. We are diving into March, and March is Colorectal Health Awareness Month. Joining us is one of my all-time favorite surgeons, and Dr. Sam Carvajal. Dr. Sam, colon cancer, colorectal health. With cancer, are there any signs and symptoms?
Well, quite often there are none.
Because it's considered kind of the silent killer.
It can present already at a very late stage when people we're having absolutely no symptoms. But some of the symptoms that can happen are a feeling of fatigue as your blood levels start to get low. We call that anemia. Sometimes a little bit of shortness of breath or exertion. Easily get exerted when you're walking, for example. We had somebody I saw today who fainted, who was having that kind of problem. That was the original presentation.
How old was this?
This person, I believe, was 55 years old.
50. Okay. So what you just said could be male or female.
It can be at any age. That people can have colon cancers in their 20s.
Is there any rectal blood loss? Is there any chronic constipation? Is there any discharge? Anything else that somebody can look for?
Well, the thing I get the most is patients who are noticing blood in their stool, and clearly that is an important thing to talk to your doctor and not ignore. But the truth is that colon cancer rarely bleeds to that extent, at least early on, where one would notice actual blood in their stool. Rectal cancers can present with actual blood streaking in the stool. But most colon cancers, the blood that is being leached out into the bowel movements is a microscopic blood. So you don't see it and only can be tested by your doctor.
Because many times if there is actually red blood in your stool, and I'm not here to diagnose, it could be a hemorrhoid, it could be a fissure or something like that. But bottom line is if you find it, call your doctor and make an appointment and say this is what's happened.
That's correct.
Talk to us, so just say someone's diagnosed with colon cancer. What are some of the procedures, doctor?
Well, after that diagnosis,
Diagnosis.
typically via colonoscopy. And
Yeah, let's dive into colonoscopy. So you even said somebody at the age of 20 should have a colonoscopy if there are signs and symptoms that they should look into.
If there's problems, absolutely.
Okay.
We don't typically start to recommend routine screening colonoscopies until age 50. But
Men and women age 50?
Men and women age
Okay.
50.
Okay.
But clearly, if there's problems, you may be referred to your doctor, by your doctor to a gastroenterologist, do a colonoscopy for problems that you may be having. But it's important to get these things and to get the help so that you can make that diagnosis. Once that diagnosis is made, though, we typically are going to order a CAT scan to understand whether there's any evidence that it's spread or not. And after the CAT scan, almost certainly you'll be seeing a surgeon like myself who will talk to you about different options for surgery. The vast majority of colon cancer operations in this country are still being done through large incisions. Well over 70% of colon cancer operations are being done through large incisions, yet the vast majority can be done through minimally invasive techniques. In my practice, 95% of all colon and rectal cancers
Fantastic.
are being treated through minimally invasive surgery.
You said over 70%. Could a lot of those have been early detection? Could have saved those?
Well, it's certainly the earlier detected, the more likely a doctor is to use minimally invasive techniques to do it. At the same time, it's really a surgeon's experience.
Okay.
And there are, unfortunately, the majority of surgeons who are doing colorectal surgery do not have a large experience in minimally invasive surgery. And it's really more surgeons who do minimally invasive surgery as their sort of expertise, like me, who are able to do almost all of their colon rectal work through those techniques.
One thing too that I want to say though in regards to colonoscopy, and everyone say, oh my God, the worst thing about the colonoscopy is the prep. And get over it, because just get over it. It is what it is, and you're going to survive it, period.
That's correct.
Also check into your family history, because it can be hereditary, yes?
Absolutely.
Dr. Sam, talk to us though just about health and diet and exercise, because a lot of people, you mentioned earlier about obesity. We are considered the most obese country in the world, which is horrible.
Absolutely correct. It's so important to do diet and exercise. It can have nothing but positive effects in terms of colorectal health, but more importantly, just for your well-being. Doing that diet and exercise will help you drink more water and hopefully decrease your dehydration and therefore have less constipation. And so there are all kinds of real positive things that happen from it. No bad things.
In regards to health and exercise, what do you recommend in regards to a healthy diet?
Well, I mean, I think it needs to be balanced. We too often go to fads and follow this and follow that. When we recommend portion control, not necessarily a high protein, low carbohydrate diet. We want a balanced diet. We think that's always going to be the healthiest for us. But most importantly is to talk to your doctor and talk to a nutritionist to help get exactly what that is going to be for you and to get on a program that will allow you to eat more healthy.
Thank you once again for joining us here on Healthline. Okay, so here's the deal. Drink 8 to 10 glasses of water a day minimally. If you are constipated, that could be one of the reasons. If you are feeling fatigued, out of breath, or have any questions in regards to you and your gastrointestinal health, call your doctor. Talk to your parents, your grandparents. Find out the medical history in your family. A lot of the stuff that happens to you is hereditary. Please follow us on our YouTube channel at GMC Healthline. Follow us on Facebook at Glendale Adventist, and also on Twitter, GAMC Health, and you can also find us on LinkedIn. Our mission here is to give you the most important information about you and your health. If you have any questions, call your doctor. Once again, I'm Gregory Zarin. Thank you for joining us. We'll see you next time.